Hello again, this is Rachel B Talks ME. I said that really fast. Okay, so this is part 2 of causes. I'm going through different websites and the different causes and what they say and kind of coming to some sort of conclusion, if there can be one. So this is part 2. So I'm looking at Healthline.com and they say, similar to the NHS one, that the cause of CFS is unknown. Research speculates that viruses, hypertension, low blood pressure, a weakened immune system, and hormonal imbalances could all be contributing factors. It's also possible that some people are genetically predisposed to develop it. Although CFS can sometimes develop after a viral infection, no single type of infection has been found to cause CFS. Some viruses that have been studied in relation to CFS include the Epstein-Barr virus. I go into that in the previous video if you want to learn more. We learnt something. Human herpes virus 6. I also went into that in the previous video if you want to learn more. Ross River virus. Let's see what that virus is. Ross River virus. Ooh. It's a mosquito-borne infectious disease caused by infection with the Ross River virus. Oh, that's Ross River fever. It's a small encapsulated single-strand RNA alpha virus, endemic to Australia, Papua New Guinea and other islands in the South Pacific. So that won't be causing my CFS, but maybe if you're in Australia, Papua New Guinea and other islands in the South Pacific, it may contribute to your CFS. And it's been previously termed epidemic polyarthritis. Oh, so it's been linked to arthritis. Interesting. Polyarthritis is often caused by a post-immune disorder. Oh, that's cool. Okay. So that's not going to affect us a lot in like the UK and America and stuff, but maybe in Australia. Back to there. So Ross River virus, which we have just talked about, rubella, Coxiella burnetii, and Psychoplasma. Coxiella burnetii? What's that? I've not heard of that one before. Okay. That's a intracellular bacterial pathogen and is the causative agent of Q fever. What's Q fever? Oh. A bacterium that affects humans and other animals. The most common manifestation is flu-like symptoms with abrupt onset of fever, malaise, profuse perspiration, headache, muscle pain, joint pain, loss of appetite, upper respiratory problems, dry cough, pleuritic pain, chills, confusion, gastrointestinal symptoms such as nausea, vomiting and diarrhea. Oh, a lot of those symptoms marry up. That's interesting. So they've probably looked into that because of the similar symptoms, I'm guessing. Okay. I'm betting that there are loads of like medical people that are watching this that are just sat there like, she's just talking bollocks. I'm just reading what it says on the website, people. Just saying. Psychoplasma. Let's find what that is. Psychoplasma is a genus of bacteria that lack a cell wall around their cell membrane. Several species are pathogenic in humans, including a pneumonia bacteria. That was mentioned on another website. Okay. Okay. Cool. Well, not cool. So researchers have found that a person who has been infected with at least 3 of the implicated pathogens have a greater chance of developing CFS. I would like to see the research on that. Kind of where that research is. I did biomedical science at university, as I've kind of briefly mentioned before, so reading research papers and stuff like that I find very, very interesting. So if you have links to any, or you know of any, please send me them, because I will really enjoy reading them, and it'll kind of keep me busy and not feeling really rubbish on my days off work. I only work Tuesday, Wednesday, Thursday. I have Mondays and Fridays off. I've had to go part-time, and one of the reasons I started this channel, other than to spread awareness, was to also just kind of keep me occupied on my days off, and to just make me feel a bit better, because I really enjoy filming. I do have another YouTube channel which I've kind of laid off a little bit because I had to stop, where I did face paint tutorials, so I'm looking at doing a bit more of that as well when I can, when I have kind of the energy. But anyway, back to Healthline.com. People with CFS sometimes have weakened immune systems, but doctors don't know whether this is enough to cause the disease, said on another one. Additionally, people with CFS sometimes have abnormal hormone levels, but doctors haven't concluded whether this is significant. So that is similar to what, I think it was the Mayo website. So this is WebMD, good old WebMD. They have the causes of CFS include immune system problems, hormone imbalance, psychiatric conditions, genetic or inherited risk, and trauma. Cool. Oh, and viral infections such as glandular fever. That's actually it. They have like... yeah, okay. Thanks, WebMD. That's Mayo Clinic again. I opened it twice. Oops. What's this one? Medical News Today, and this is an article. Oh, that's so true. I just read the first line and it says, well, yeah. Chronic fatigue syndrome is much more than just feeling tired a lot. Oh, it's so true. There are the symptoms. Here we go. Next page, the causes. Cause of CFS is unknown. Yes, that is a given. Possible triggers. Researchers are studying the relationship between stress, immune system toxins, central nervous system, and activation of latent viruses. Some researchers suspect it may be caused by a virus such as Epstein-Barr virus, human herpes virus 6. However, no specific virus has been identified as the cause. Some suggest it may be caused by inflammation along the nervous system, and this inflammation may be some sort of immune response or process. So similar things, kind of what I was thinking and what has been said along the line. This is patient.info. What do they say? Factors are thought to contribute to some people developing CFS-ME include genetic susceptibility, viral infections such as glandular fever. That appears to be a real recurrent one. Exhaustion, mental stress, depression, traumatic events such as bereavement, divorce, or redundancy. The following factors are thought to make it worse. So they've got this slightly different. Recurrent infections, not being active enough or being too active. Okay. Stress, poor diet, I guess. Being socially isolated or being feeling frustrated and depressed, that can definitely make it worse. That makes me worse. Environmental pollution. That's a new one. Okay. So that's what patient.info says. And this is Healthline again that I have opened twice. So that is actually the last page that I had opened. So we will leave it there. I hope you have found this helpful, just to talk about potential causes. Let me know what you think. You can look at the video about what I think, and I will see you next time. And I think, you know what, I haven't figured out what the next video is going to be about yet. I have a massive list and I'll figure it out. So I'll see you guys next time. Hope you enjoyed this. This one is so much shorter. Anyway, I just got like really like I was surprised by how short this one is, but I'm quite proud of myself. Okay, see you guys later. Bye!